People still trickling in. We'll wait another minute and then get going. All right, let's get going. If we could all please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Dr. Card, for providing a flag. We have a very limited agenda tonight. Before we jump into it, just want to thank all of the board members, administrators, Dr. Zazo, who's here, as well as all of you participating online for attending this meeting. I do know it was very last minute. I think once we discuss the topic, it'll be very evident why we did this tonight and on such short notice. So with that being said, would someone please like to make a motion to approve the amended reopening plan revised on June 7th, 2021 to make outdoor mask use optional effective immediately? Dr. Eckers, second, Ms. Tell. Discussion? I think that's a terrific idea. So just as sort of background, the governor today held a news conference in which he said that masks outdoors for schools will be optional. This is a walk back from what was put out on Friday, which was masks optional all throughout. So that was initially walked back. I'd be remiss if I didn't mention, because council will get mad at me if I didn't, that this is still not in writing. This was only in the news conference today, and as Friday's release was walked back, we don't know what the future is going to bring for this. So if we do decide to move forward and agree to say that we'll make it masks optional for schools outdoors, if something comes down in writing or there's a change to what the governor has said, like we've done since the beginning of this pandemic, where we just kept having to roll with the punches, we're going to have to continue to do so. And if something comes out that says we're not going to be able to do this, then we're going to have to walk this back, like the governor has walked back what his initial statement was also. All right, so I just wanted to put that out there. Dr. Zazo was nice enough to join us today, and we appreciate that on such short notice, as well as the district's position. I am going to ask him to give his opinion on this and what his thoughts are with the health and safety of our kids and staff and administrators with the option of not wearing masks outside. Dr. Zazo?
Hi, how are you? Great, thanks. I'm glad I could be here tonight. I'll tell you, as both Board of Health and the school district physician, if this sticks, I am all for having children have the option, at least right now, of outdoors with no mask. The numbers in the county and the state are below 0.4%, 0.4%. There is very little COVID burden in the community, which is good. Nassau County is already at 75%. We've hit the herd immunity number for Nassau County for adults with at least one dose of vaccine. So I'm very encouraged by that. And we're seeing very little disease burden in the hospital. So from a safety standpoint of the students, outdoors, there is almost never a risk of any transmission, especially in this weather. More risk of the kids having issues, obviously wearing their masks in 90-degree weather. As long as this sticks, and I agree with you, the governor likes to walk back things. I'd like to see this in writing. But once we do get the official word from Albany, my medical opinion is that this should be implemented. It's a good idea. And again, we'll watch what happens with indoor masking. Again, the same procedure. We'll see where it comes from. The issue that came real quick is that the Dr. Zucker, the state commissioner of health, sent a letter to the CDC saying this is what we were going to do. Unfortunately, it doesn't work that way. You have to wait for the CDC to tell us what to do, and then it filters down. So again, I think we're moving in the right direction. I feel very comfortable for the safety of children, staff, parents, that the outdoor option right now, and leaving it optional for those that are comfortable, is absolutely safe and okay to do.
Excellent. Thank you, Dr. Zazo.
Sure.
Are there board members who have questions for Dr. Zazo or otherwise? We might as well pick his brain as long as he's here. Dr. Luce?
I just want to first say that I'm thrilled that we're moving in the right direction. I mean, not necessarily a question for Dr. Zazo, but do you see any changes? do you see any changes being able to come forward as we reach that 70%?
Right. As far as masking indoors, or what aspect?
Yeah.
Yeah, I honestly believe, I'm going to tell you, we're getting near the end of the school year, so it's almost going to become a moot point.
Yeah.
My feeling is that once school year ends, they're going to rescind the indoor mandate. I think that's where we're going to go with it. So we're moving, nationally, this is moving, keeping apolitical, every state is moving in this direction at different pace, different speed based on their community. But I think we will be there, absolutely.
Could I just jump in and ask Dr. Zazo a question? Given that we're almost at the end of the school year, and it's probably unlikely that there'll be any rescinding of the indoor masking policy, one of my thoughts is to have a conversation with our elementary and secondary principals about increasing mask breaks. Do you think that is a good idea?
Yeah, absolutely, Dr. Card. I think with the heat now that we're dealing with, we've had these little heat waves. I'm seeing, at least in my practice, a lot of asthma and other issues, the kids that have respiratory issues. I think increasing mask breaks, and we keep a close eye. Obviously we're keeping a pulse on it. If we see any spikes, quite honestly, I can tell you in my own office, I've had one positive in the last 2.5 weeks. So we're seeing minimal disease. I think that's a great idea. Yes, allowing them based on their school. I think we should increase their mask breaks. I think that's medically safe to do.
Very good. So for everyone out there, we will be having that conversation tomorrow with the elementary principals. I saw Ms. Baruch's hand up.
I just had a quick question as it pertains to the vaccination, especially if we're going to have, future discussions. When do you see it as being likely that the vaccine will be approved for anyone younger than the age of 12? Because right now, the bulk of our students are not eligible for vaccine.
Right.
And so it unnerves me a little bit that the governor is putting a cap saying we have to hit a certain number before we can, when we don't have the opportunity really, because most of our students are not yet approved.
Right. That's a great question. A couple of things going. I think one, we may see in the fall a 12-year-old and over mandate for the vaccine for school entry, and that's what they're bouncing around. We'll see what happens. But that will be that most of the 50 states are going to propose that. So, we're going to have to kind of follow that. We'll see where that goes. The pace that we're going, I suspect that we will see maybe by mid-fall the 9 to 12-year-olds. By late winter, even under that. Moderna's already tested down to 6 months with fantastic results, safety. Yeah, a lot of parents actually volunteered their kids, and we appreciate them doing that. The vaccine is very safe. I mean, I've had it myself. My family's had it. I think it's important. They're going to move fairly quickly. Now, Pfizer is getting full approval. Moderna's next for full approval. And just to clarify, emergency use authorization approval is not a partial approval. The full approval is more business or administrative than clinical. It means that they're allowed now to advertise the vaccine directly to the public, and that then once the pandemic is over, they can still sell it on the market. So the full approval has nothing to do with clinical safety. It's purely a business administrative thing. They're moving well. What we're seeing with children is, remarkably, they're getting 100% protection. The only thing that's even that close to this in most is the measles vaccine, which is 97%. So the 12s, we're getting good results. We're doing it in our office now. We're immunizing a lot of kids with really not seeing any significant side effects. Kids, luckily, seem to have a lot less side effects than we do when we get it, especially like I had the disease back last March, then getting the vaccine, you get a little bit of a reaction. But I suspect we're probably going to see by mid-fall, maybe the 9 to 12-year-olds. And then they're doing it in 3-year blocks.
Thank you. I actually appreciate the knowledge about the emergency use authorization versus the full authorization. So thank you for adding that.
No problem.
Yeah, I'd like to echo Ms. Baruch's statements and say thank you for that. That education piece is very important.
Sure, my pleasure.
Okay. Are there any other board members who have questions or comments about this? I think we'll go to a vote because we're doing this via Zoom. I'm going to call everyone out individually so we can make sure your vote is counted correctly. So we're voting yes would be for amending our plan to provide that mask use outdoors will be optional starting immediately. Ms. Baruch.
Yes.
Dr. Eckers.
Yes.
Ms. Tell.
Yes.
Ms. Napolitano.
Yes.
Dr. Luce.
Yes.
Ms. Benowitz.
Yes.
And from me is a yes, and that is 7-0.
Mr. Melnick, can I just ask one quick question of Dr. Zazo? I just want to clarify. I think it's
Sure.
important.
Thank you.
Can we clarify your statement about mandating children?
Before he
Yes, I mean-
clarifies, that, just to speak to that question, and then Dr. Zazo, the school district at this point is not mandating anything.
Thank
That's
you.
correct.
Dr.
Thank you.
Zazo made a
That's correct.
statement about 50 states possibly doing
Possibly,
that.
yep.
So I'll
That's
turn
what
it
I
over
wanted to clarify. Thank
Oh,
you.
okay.
Yeah, there's talk about, the 50 states, again, we have to wait and see New York, but there is grumblings at the state level that they potentially will bring this forward. That hasn't happened yet. If it doesn't, that's fine. But, just so that you make you aware that that may be a possibility.
Thank you.
Again, the school district is not mandating
Mandating, correct.
anything. So please, no emails tomorrow about vaccination
Correct.
mandates. Thank you.
That is not our.
So with that, I think we are done. Again, I want to thank everyone who jumped on this fairly quickly after the governor made his statement today. Hopefully, we will get something in writing from the governor's office soon that will corroborate what he actually said today. And we will continue updating the community as we receive that information as well. And with that, would someone like to make a motion to adjourn the meeting? Ms. Baruch, second. Ms. Napolitano, all in favor, and I'm going to do the same thing. I'm sorry. Ms. Baruch,
Yes.
Dr. Eckers,
Yes.
Ms. Tell,
Yes.
Ms. Napolitano,
Yes.
Dr. Luce,
Yes.
Ms. Benowitz.
Yes.
And with me, we are officially adjourned at 7-0. So thank you. Thank you, everyone. Have a safe night. And please join us for our next board meeting, which is
June 16th.
Next Wednesday,
June 16th. Thank you.
Thanks all.
Good night.